A historic investment into rural health care across the U.S. and especially here in Texas.
Yeah, our state will receive more than $281 million each year for the next 5 years in order to strengthen the rural health workforce and technology. KVUE's Malia Masamoto spoke with one rural pharmacy in Blanco, hoping this new funding makes it out to them.
For the pharmacists behind these counters,
we're probably the first ones to know if something's not going right with some of these people.
And for Blanco's population of just about 2,000 people, it's a place many visit more frequently than a doctor's office.
We're frontline healthcare providers for a lot of the people in the area. We're here for a lot of questions I think that people have that might save them from going to an emergency room visit.
But with competition from big box pharmacies, Shaban Ashley, the owner of Blanco Pharmacy and Wellness, worries what the community would do without this place that's been here since 1880.
I think it would be frustrating for people and difficult, if not impossible, for a lot of people.
But Monday, the Centers for Medicare and Medicaid Services announced a huge milestone in rural health care, $50 billion to strengthen the rural health workforce and modernize technology across the U.S., with Texas receiving the largest chunk, $281 million each year for the next 5 years. Earlier this year, RFK Jr. advocated at the Capitol for Texas to prioritize rural health initiatives.
And when they lose them, as we talked about before, it's not just the hospital that closes, it's the pharmacy that closes, it's the stores that close, and the community collapses.
The Texas Health and Human Services Commission said the funds will be allocated for initiatives that offer grants to reduce chronic disease, use AI and telehealth services, and recruit and retain rural healthcare workers. And with a community pharmacy closing every week in Texas, Ashley hopes this funding will not only go to the rural hospitals, but also pharmacies.
We're hoping that we, can get paid for the chronic care management, for remote patient monitoring, for medication review that we do. We're just the big part of the healthcare needs as the hospitals are.
In Blanco, Malia Masamoto, KVUE News.
And local governments, rural hospitals, and health providers will be able to apply for that funding in the spring. For more information, you can look for this story on our website at KVUE.com.